Ladies and gentlemen, welcome to In Our Community. I'm very excited today to have Lauren Mayfield on the show. She's the owner of Full Hearts, and she's an unbiased Medicare advisor. That's what Full Hearts does. Lauren, could you tell us a little bit about yourself personally?
I would love to. Thank you for so much for having me on the show, Mark. My name is Lauren, and I am a proud Texan. I was born in Lubbock, Texas, which is up in the Panhandle, and to my biological mother, she had to give me away when I was 2 days old to my first foster parents who came and picked me up with their son, who was 12 years old, and they lived in Plainview, just a little bit north of Lubbock.
Okay.
And that day, when I was 9.5 months old, they adopted me.
Okay.
So I was able to grow up in the Plainview area in a beautiful country home, being able to be enveloped by the Texas winds, Texas sand, and the Texas culture. I loved it. And my mother got cancer when I was about 12 years old, and she
Okay.
survived it. But to kind of reconnect, she wanted to be closer to her family who lived in the Houston area.
Okay.
So when I was 12, we moved to Conroe, which is just north of Houston.
Okay.
I loved the new setting, not as much dirt and wind, but a few more
Right.
trees in that forested area.
Right.
And I loved that area. And there had a little bit of a turn when I was 16.
Okay.
It was August 5th of 2001, and I was hanging out with one of my best friends. It was a balmy 100 degrees outside, and we were just about a week away from starting our junior year of high school.
Okay.
We went on a car ride, and my Volkswagen Beetle is a 99, and we
Okay.
saw a couple of guys that we thought were pretty cute. So we got
Good.
behind them, and they sped up and we sped up. And unfortunately, it wasn't a cute guy I had a crush on who I was flirting with. I was flirting with danger.
Oh, geez.
I went
Oh, my
around a
goodness.
curb too fast and went into the
Really?
skid,
Oh,
turned
God.
away from the skid instead of into it, hit the ditch, and flipped 8 times.
Oh, my God.
I
Oh,
shattered my skull in several places.
oh,
The first
oh,
responders came and they had to remove my lifeless body from that car using the jaws of life. And they sent it to the hospital where they were crossing their fingers I would even survive.
okay.
I had a traumatic brain injury with subdural hematomas. They had to get a doctor, specialty doctor, to do that surgery.
Okay.
And they were just crossing their fingers that I would survive, let alone if I
Oh,
would
my
exist.
God. Oh, geez.
I was in a coma for 2.5 months and not supposed to
Oh,
come out of the vegetative state, but I came out of that coma.
okay.
When you come out of a coma, you don't just wake up and start over again. You have to reset your brain. You have to learn how to walk, how to talk, how to feed yourself, how to exist all over again. In my recovery unit, I was with stroke victims, Alzheimer's patients, multiple sclerosis patients, patients much older than I was, but we were on the same page in recovery. We connected with some of the biggest bonds, and they're still some of my best friends today.
Oh, oh, that's nice.
A year and a half later, after all this, I got out of the hospital and was able to graduate with my high school class.
Oh, congratulations.
And I was just elated. My parents were moving after that to go to near Dallas, Fort Worth area to be
Okay.
close to my brother. He was 12 when I was adopted. And
Okay.
here he is in his 20s, and he already had
Oh,
a family, and my parents
my
wanted to be
goodness.
close to them.
Right.
So we moved up to the Dallas area.
Okay.
I started attending college at Weatherford
Okay.
College,
Okay.
where I met my husband.
Oh, very
He
good.
is my biggest sweetheart. We got married and we lived in his hometown for a little while, just west of there in Mineral Wells.
Okay.
Graduated with his associates, and we moved to Corpus Christi. We went to
Okay.
Texas A&M Corpus Christi, and he got his master's. I got a little bit of college in, and we
Right.
just had so much fun in that coastal town.
Oh, that's nice. That's very beautiful.
He graduated with his master's in business administration and was looking for a good job.
Right.
but unless you're in oil or tourism, there's nothing in that area. So we
Oh
moved
boy.
up to the Dallas-Fort Worth area where we are now, and I'm in Frisco. The Texas Star is here, the practice stadium for the Dallas Cowboys, and
Very
I'm
good.
loving it.
And we have a great rivalry with the Niners, by the
Ah,
way.
you know,
Yeah.
49ers and Cowboys.
Yeah.
Who watches sports ball, you know?
Yeah, exactly. So what brought you to start doing full hearts? What do you what why and what motivated you and like that? And when did you start it?
Well, like I said, when I was in the hospital, I was in recovery with the senior individuals. So we saw each
Right.
other eye to eye, and I really connected with them.
Okay.
After I did some, human resources for a phone company, I understood that I could understand insurance. So I
Hmm.
started at Physicians Mutual selling supplemental insurance under a temporary captive agent license.
Okay.
The Physicians Mutual got its leads from doctors' offices and little
Okay.
pamphlet handouts where it would say, fill this out for free Medicare advice.
Oh wow.
I have learned from some very wise individuals if something is free, you are what's for sale. I would
Oh
be
boy.
handed hundreds of these slips every week and call them and just supposed to be told to sell our supplements. They
Yeah.
handed me a Medicare handbook and I said, that's just because we have to hand you that by law. Sell, sell, sell.
Right.
I actually had a heart for these people because I remember what it was like being in the hospital with them.
Right.
So I'd point them in the right direction, even though it wouldn't be with our company. I had a full heart and I would point them where they needed to go.
Okay. That's very
I,
beautiful.
I made contact with this one lady in Amarillo near where I grew up named
Okay.
Lauren. We connected. She had multiple sclerosis, had been just diagnosed.
Oh
My
geez.
mother-in-law had just recently passed away from multiple sclerosis, so my heart was in her hands from the moment I spoke to her. And I pointed her in the right direction, which wasn't with a Physicians Mutual, but with another company.
Oh my
And I told her
gosh.
which plan she needed to get and everything, and hung
Did you
up the
get in
phone.
trouble? You get in trouble for that or not?
Well, my sales didn't amount to anything that week.
Okay.
She did a little digging herself, found
Okay.
my name, phone number, and address, and sent me a Christmas card. It
Oh,
had an angel pendant in that Christmas card with the amount where I pointed her to go of commission that salesperson had made. She paid me out of her own pocket and thanked me for actually
oh,
caring and helping for her and
isn't
said,
that
please do
beautiful?
this with as many people as you can.
That's beautiful, honey.
I
Jeez.
put down my Physicians Mutual hat and I made my own company, Full Hearts, a non biased Medicare advising agency where I
Okay.
don't receive commissions. I help people on a one time fee to find what they need.
Very beautiful. What year was that?
That was 2 years ago,
2 years ago. Congratulations for starting it.
2022. Yes, thank
Now,
you.
what it I haven't gotten my questions queued up yet. I should have done that. I've got them here. I just need to go find them. Let me see if I can. Let me do that. I've got them right here because you had some things you didn't want me to ask. But
Mhm.
so we talked about what drove you into the Medicare field.
Yes.
Um, what is the difference between a Medicare agent and a Medicare advisor?
An agent is someone who sells a supplement and advantage plans and gets commission off of those plans,
Okay.
a
Okay.
very high commission.
Oh,
I know
really?
this because I
Huh.
was from that. That was what
I
made
didn't
my
know
paychecks.
that.
I made 5 sales a week. I'd get $1,000 in my pocket.
Jeez.
An advisor is someone who knows what the government's going to provide. They're not going to get commissions from pointing at you to a government plan.
Right.
Or maybe they know this company sells this supplement which you need. They're not connected with that company, but they know the ins and outs and how to get the best rates, who to speak with, how to bypass those commissions, maybe going straight for the company. An advisor has you in mind, not their pocketbook like an agent does.
You must have had to study a long time to learn the ins and outs of the government stuff because that bureaucracy is just endless. It just never ends.
Medicare is an ever-changing policy in the government, and Medicare is actually different per state.
Oh, is it
Texas and
really? Even
Florida,
though it's a
yes,
national plan?
yes, Texas and Florida have some of the most benefits for their people on Medicare.
Okay.
Texas has 142 plans. Most
Oh my
people
God.
around this country, there are four generic solid plans, but Texas has 142, and I have the ins and outs, and I keep up with the law changes, so I know how to help someone, when to tell them to change, and how to get out of
Wow.
those penalties. And I love it.
There must be a lot of study though. You
It is
must,
the updates for last year's Medicare changes
yeah.
was a 182 page, size
Oh,
8 font, no graphics booklet.
oh my God. I don't know how you do it. I do not know how you do it. And there's plan A, B, and there's a C and a D as well, right?
Those are the basic four that most people know about.
Yeah.
A covers hospital insurance. B covers your doctor's visits.
Okay.
C is also known as Medicare Advantage. That's a
Okay.
private insurance paid out of your pocket, not having to do with your tax dollars that you've earned. And D is your prescription plan coverage. I can
Okay.
remember it as D for drugs.
Wow. Okay. Wow. That's just what I know we've covered a little bit of this, but what made you become an unbiased Medicare advisor? I mean, the part about being unbiased, you emphasize that a lot. What motivated you to do that? Because you could have probably made more money in another way, right?
In a heartbeat, because I'd be getting commissions off of pointing people in the directions. But I
Yeah,
hate it when sales are driven by commissions and not what the person needs or wants.
right.
When the person needs that government plan because their budget is drained, they're living off of groceries from the Social Security income.
Yeah,
I want to help them find, okay, this is the plan you need because I have a
right,
heart for that and I actually care for
right.
people and have empathy and sympathy for those individuals
Okay.
and not just my pocketbook. I want to help people because I understand and I want to break it down so they can too.
Okay. So tell me a couple of stories about your favorite good or bad stories of interactions with clients. What has happened since you started? You started 2 years ago, you said.
Yes.
So what's it been like? What are
One
some
has been Dave. He was an awesome, world renowned anesthesiologist who was in my networking circle.
okay?
I am always talking and preaching when you turn 65, sign up for Medicare. Otherwise, you're going to get penalized per year after that you can't easily get taken away.
Oh,
He's up there, he turned 65, and he's like, you know what, I can do Medicare. I'm a doctor. So he went to Medicare.com and SocialSecurity.com, signed up, and he came the next day to the networking event, said, Lauren, I took your advice and I signed up at Medicare.com and SocialSecurity.com. I looked at him and I said, please tell me you're joking. He's like, what? That's what you told me. I'm like, you sign up on the .govs. .com is actually a predator site that
oh
steals your identity theft.
no! Oh my God! Oh Lord!
He
Oh
face
boy!
palmed and we got a band-aid put on his identity theft. On top of all of that, he went to the actual .gov sites. He's an
Yeah.
anesthesiologist and he said, this is Greek to me. I don't understand. So I walked him through step by step how to sign up for Medicare.
Okay.
And now he is my biggest flag waver saying she actually knows what she's talking about.
Oh, that's beautiful. That is very beautiful.
Another
Okay, now
client of mine.
we do have time still. So, oh boy, I lost my time. Tell me another story for now. That would be good.
Okay.
Of, tell me another story of something that happened.
I had another client who came to me wanting help with Medicare, but it was a little bit of a different story. He was a retired Marine, retired police officer, and he had VA insurance. He never touched his Medicare, but he wanted a bigger Social Security check. So he's like, can you get me the cheapest plan so I don't have to draw out of that?
Okay.
I into it, and he never touched his Medicare because
Huh.
he had very viable VA coverage, which he had paid for with the service to the country.
Right.
Him
Okay.
unenrolled from Medicare.
Yeah.
I had to put in 1,000,000 forms and have it declined the first 5 times automatically. And I found a loophole in the system how to get him unenrolled from Medicare. And I stood in front of a board of government officials, presented our case. I had to present my NPN number, which stands for National
Now,
Producer Number, whenever I passed my
can I
insurancing
get you
exam.
to slow down a little bit here? Tell us
Yes,
about this board. What board is it? Why did you have to present to them on its behalf?
it was a Social Security board. And
Okay.
because Medicare is a Social Security benefit, since it's government provided and they, automatically deduct from it, whenever you sign up for Social Security, they usually make you sign up for Medicare as well. And
Okay.
there's no
Is
options just to say, I don't need it. Don't do that for me. So I had to show to the board that we had viable coverage through other sources, being the VA and his police officer coverage that
right.
would take care of him. And he didn't need or touch his Medicare. So he wanted to unenroll so he could get more benefits from his Social Security check.
Right.
I
Okay.
happily informed him 20 minutes after the meeting. They told me you're approved. And I told him he's going to be getting now $250 more on his check each month.
Okay. All right. And do you have to go before the Social Security Board very often?
He was my first time to be unenrolled from it's only for the unenrollment status, but he
Okay.
was my first, and I cannot wait to represent more veterans and first responders because they
Yeah.
didn't know that that's an option so they can receive more on their Social Security benefits.
Okay. Now, tell us basically what can you walk us a little bit through the steps of when somebody uh gets ready to have Medicare? How do they go about it? Like, what are the steps that, and if you can make it a little bit simple, I would appreciate that. I'm a simpleton at heart. So what are the steps and when does that happen?
You qualify for Social Security when you're 65 or if you're disabled.
Okay.
When you're qualified to get a Social Security check, you qualify for Medicare.
Automatically or
Yes.
okay.
A Social Security check means you get benefits from Social Security, and Medicare is one of those benefits.
Okay.
If you sign up late, you can get penalized. So as soon as you see that Social Security check or get that notification, it's imperative to sign up.
So you have to do something to sign up for Medicare. It's
Yes,
not totally automatic.
yes, it is now all virtual online. There's no paperwork involved anymore. They've actually phased that out in the last decade.
Right.
So you can't just mail in filled out Social Security form from the post office. You have to go online to print it out. If you don't have a connection online, like an email address and all that, I would highly suggest getting a Medicare agent or advisor who can help you do that. And I'm proud to be an advisor, so I can help with that as well.
Okay. So is that signing up for Social Security or is it signing up for Medicare or does one automatically do the other or not?
When you sign up for Social Security, it automatically sends you to the next site as part of the steps in doing it.
But
You
then you
can't get
have
your
to
Social
do
Security
something
check.
at that other site.
Yeah, it's putting in a lot of information, which is why make sure you go to .gov and not the .coms. We're
Right.
talking about your Social Security number, your birth date, your address, bank
Right.
account information that you want it deposited to, and
Okay.
several factors like that.
All right. Okay. Well, we're getting close on time. You have a little bit left, but not a lot. What thoughts do you have here at the end of the show? What do you want to say to the public? We're not allowed to openly pitch on this particular show, but other than that, what guidelines or general topics about Medicare would you like to leave with the public?
Medicare is something you've earned through every paycheck that you've earned in your life. It's taken out with the
Okay.
Social Security tax.
Okay.
You paid for this. You need to make the most out of this benefit once you receive your Social Security check. So make sure you do your research and understand it's not just a, oh, I'm signed up for A and B, I'm good. You need to
Mm,
know your historical background in your family, your medical background, what doctors you see. Not every doctor takes every form of Medicare. And
right.
if you want to be able to stay healthy and enjoy your retirement, you need to have a good health plan. So I highly advise making sure you understand your options.
Okay. Now, do you work with people from all over the United States or just Texas or what?
I am only licensed in Texas, but I am expanding and I can point you to an unbiased advisor in your area if you need it, because I
Oh,
do have many networking friends.
very beautiful. Very nice. All right, we're gonna kind of wrap up. I lost the time a little bit, but I think we're okay. Ladies and gentlemen, we have been visiting with Lauren Mayfield, who is an absolutely delightful person, an unbiased Medicare advisor who's giving us some general information about Medicare. We hope to do another show probably in a month or 6 weeks, something like that. And it'll be a little more specific. Thank you all for watching. And this has been In Our Community. I'm Mark Isaac Potter. We're visiting with Lauren Mayfield. I'll see you guys next time. Take care of yourself. Thank you very much, everyone. Oh.